See, as I told you, I am not at all concerned about the question. Guys, another 1 hour completely be with me. As I told you, I am actually not at all concerned with the question there, guys. With the question there, I'm concerned with the concept. I'm concerned with what, guys? Yes, the concept there, guys. Okay. And the concept here for your MCA exam, yes, welcome here right now, the classification of amino acids. So, take my words, there'll be a short question, a definite question, guys, a definite question, about the classification of the amino acids. A definite question about the classification of amino acid. So 1 mark definite from today onwards, guys. Okay, na? So from today onwards, you start preparing for 299 marks. So welcome to the first topic here right now, classification of amino acid. They are totally they are totally like 20 amino acids, and out of 20 amino acids, my dear doctors, remember that all those 20 amino acids are divided. I'll give you like three classifications here right now. Okay, so now welcome to the classification number one. The classification number one of the amino acid is actually based on structure. See, because we have got less time, we have like only like hardly like 1 hour of the time, 1 hour of the time there, guys. So please do one thing here right now, write down quickly along with me, and I'm just going to show you all the pictures here right now, so that we don't waste time in just writing there. Is it okay? So come on, guys. Okay, so 1 hour completely be with me. It's all about the concepts here right now, sir. The first concept is about the classification of amino acid, guys. Come on, come on, come on. Take another color pen there, another color pencil there. Write down, likho wahan par, definite question. Short question, guys. One question is definitely going to come from here. Based on structure. And remember, based on structure, all your 20 amino acids are divided into 7 groups, guys. Based on structure, all your 20 amino acids are divided into how many groups? 7 groups. The first group will include the aliphatic amino acid. The first group will include aliphatic amino acid. Number 1, glycine. Number 2, alanine. Number 3, valine. Number 4, leucine. And number 5, isoleucine. Okay, now, wherever you are, whether at your home, whether at your hostel, wherever you are, guys, come on, tell loud and clearly. Come on, sir. So you're also gone. I'm also gone. Aap bhi pagal, main bhi pagal. Okay, na? So come on. Glycine, alanine, valine, leucine, isoleucine, all these are aliphatic amino acids. They're having like open chain. Now, second group here right now will be your hydroxyl group containing amino acid. Hydroxyl group containing amino acid. By the way, my dear friends, what is the formula of hydroxyl group? What is the formula of the hydroxyl group, guys? Come on. What is the formula of the hydroxyl group? Hydroxyl group formula will be OH group. Lovely. Is it okay? And they are the OH group containing amino acid. Number 1, serine, and number 2, threonine. Number 1, serine. Number 2, threonine. I hope you people are writing there, guys. Everything you write down there today, whatever I'm telling you, please write down. Just 5 days for the exam. Okay, every concept is like a very high yield. A question is going to come from there. Okay, next one. Next group will be the sulfur containing amino acid here right now, guys. Okay, amino acids containing sulfur. Threonine will be sulfur containing amino acid. We are learning about the classification based on the structure, based on different types of structure, guys. Next one, acidic amino acids. And what are acidic amino acids here right now? Yes, number 1, aspartic acid. Number 2, glutamic acid. Number 3, asparagine. And number 4, glutamine. I repeat again, aspartic acid. Number 2, glutamic acid. Number 3, asparagine. And number 4, glutamine, guys. Normally in my regular classes of biochemistry, we have got like a lot of time at that time. I'll make the students write down all the things, guys, along with them. But here, because we're having like less time, let us not waste time in writing there. Is it okay? So let us just do it very quickly here. So acidic amino acids are aspartic acid, glutamic acid, asparagine, and glutamine. Lovely. Basic amino acids will be lysine, arginine, and histidine, guys. Lysine, arginine, and histidine. These three will be the basic amino acids. Okay. And after that, my dear friends, yes, the next one will be your aromatic amino acid. Aromatic amino acids will be having that cyclic ring in them. And those will be actually your tyrosine, another one will be tryptophan, and another one will be your phenylalanine. Tyrosine, tryptophan, and the phenylalanine. Okay. Last year, 2019, June exam, there was a question based on tyrosine. And last year, December 2019, there was a question based on arginine, guys. I'll tell you all the questions one by one. And now welcome to the last and final, the seventh group. The seventh group will consist of amino acid, IMINO. It's not amino, it's amino. Because in the structure, it will be having the amino group actually. Amino, ring structure will be there. and that amino acid will be your proline or proline, whatever you love to say. ठीक है जी? So therefore, in total, my dear doctors, how many amino acids are there? Come on, guys. In total, my dear friends, how many amino acids do we have right now? There are totally 20 amino acids. Come on, let's revise together. ठीक है ना? See, nowadays during the lockdown, it's all like lockdown, and we are at home here right now taking online classes. है ना? So already my dear friends at my home they have declared like तुम तो पागल हो गए हो, लैपटॉप के सामने भगते जाते हो, ठीक है ना? तो मैं भी पागल, तुम भी पागल. Come on, let's tell loud and clearly. Come on, loud and clearly right now. Come on. So all 20 amino acids are divided based on the structure into how many groups? 7 groups. Number one, guys, aliphatic amino acids: glycine, alanine, valine, leucine, isoleucine. I repeat again: glycine, alanine, valine, leucine, isoleucine. Number two, OH group containing, hydroxyl group containing, serine and threonine. Serine and threonine. And number three, sulfur containing amino acid, that is cysteine and methionine. Cysteine and methionine. Number four, acidic amino acid, aspartic acid, glutamic acid, asparagine, and glutamine. And then we have got the basic amino acid. Basic amino acids are lysine, arginine, and histidine. Aromatic will be tyrosine, tryptophan, and the phenylalanine. And amino acid will be your proline. Amino acid will be the proline, guys. Is it okay? These are all the 20 amino acid based on structure. Based on structure, guys. Okay. In this, I want you all to remember one thing here right now, guys. Out of all these amino acids, remember these three guys, valine, leucine, and isoleucine, they are said to be your branched chain amino acids. In their chain, they'll be having the branch. Yes, that is your branched chain amino acid. Okay, now. My dear doctors, all of you, okay, don't worry. I'm seeing like many messages coming regarding anatomy. I'm scheduling that. I'll post very soon the link for anatomy also. Don't worry about that one. Abhi ke liye, you people don't worry about anatomy and all. Now try to utilize this 1 hour for biochemistry, guys. 17 marks. It's not a small thing. 17 marks, guys. So don't worry. I'm along with you people. I'll help you all in that one. Okay, na? So let's clear this exam. Another 5 days. Let's try to get as many marks as possible from here. So chaliye, classification number 1 done. Classification number 2, guys, no disturbance at all. I will do anatomy, don't worry about that one. Now concentrate on biochemistry. I want all of you to clear the exam. I don't want you to be next time in my MCI class, you have to be in my PG class. Is it okay? Welcome to the second classification here right now. Yes, love you all. Look here. Based on the nutritional requirement here right now, guys, they are divided into 3 categories: essential, non-essential, and semi-essential. Essential amino acid, we all know very well, guys. Yes, those are the amino acid which are not produced inside the body. They are not produced inside the body, and they are essentially required in the diet. Essential amino acids are not produced inside the body, but they are required in the diet. Now, my dear friends, they will never ask you about the definition of this one. They're not concerned about definition. It's all about the examples. So out of these 20 amino acids, which will be the essential amino acids? So I'll do one thing here. I will mark them and you please make a note of them, guys. Number 1, valine. And number 2, leucine. Number 3, isoleucine. And then number 4, write down there, threonine. And number 5, methionine. And after that, my dear friends, write down all your basic amino acids. That is your lysine. And then tyrosine we can produce inside of a body. Remember, the tryptophan, and another one will be your phenylalanine, guys. Okay, my dear friends. So these are all your, amino acids which I've highlighted here. All the amino acids which I've highlighted here in the blue color, all of them are the essential amino acid, guys. I repeat again: valine, leucine, isoleucine, threonine, methionine, and then lysine, and then tryptophan and the phenylalanine. All these are your essential which cannot be produced in our body. Sir, okay, you are learning like this. Well and good, sir. What about we people right now? How to learn that one, guys? Yes, welcome here right now. How to learn that one, I'll tell you. For all the people who are like mnemonic lovers, okay, right down there, essential amino acid you're going to remember with the mnemonic as TV till 8 p.m. TV till 8 p.m. guys. Come on, guys. Come on, my dear doctors. Okay, TV till 8 p.m. Now, what is the reason why I'm using 8 here right now, guys? They're totally 8 in number. They're totally 8 essential amino acid. Let us see what is the full form of that TV till 8 p.m. एक बारी ना दोबारा revision हो जाएगा. Let us see like one more revision here right now, guys. Now, come on, guys. In TV, T stands for threonine, and V stands for valine, and then TV till T stands for tryptophan, I stands for isoleucine, L stands for leucine, and one more L for lysine. And I told you 8 p.m. P stands for phenylalanine, and M stands for what, guys? That is nothing but your methionine. Lovely. Okay, now TV till 8 p.m. TV till 8 p.m. I think that is the best way to remember for the last 5 days, guys. Is it okay? Done here right now. These are your essential amino acid. I told you how to remember them. And now welcome to the semi-essential amino acid. Now what are the examples of semi-essential amino acid? There are two of them. Number one, you'll be having your Arginine. Number one, there will be Arginine, and another one will be your histidine, guys. So number one, there will be arginine, another one will be histidine. These two are your semi-essential amino acids. Semi-essential amino acid. Fine. So out of these, my dear friends, if you're able to observe here, number one, arginine here, number two is your histidine. So these two will be the semi-essential amino acid. And now, my dear doctors, remember that. Now, just to torture you in the exam, what I will do is that semi-essential amino acid, I'll just do one thing. Arginine and histidine, sir said in the class, well and good. I'll give you first option arginine, second option is given as histidine. Both the options I'll give you in the exam. Then what will you do? Remember, out of these two, the better option will be arginine. And already this question has been given in your MCA exam. So MCA examiner is interested in semi-essential amino acid. Take care about that one. Very good. Okay. Now, after that, my dear friends, I'm not at all going to learn the non-essential amino acid. Non-essential amino acid will be rest all. Rest all will be non-essential amino acid. I think that's the best way to remember this one. Okay. So based on the new acid, better you divide them into essential, non-essential, and the semi-essential. Essential, we are going to remember as TV till 8 p.m. Non-essential will be rest all, like semi-essential will be arginine and histidine. Agar dono option diya jayega, both the options are given, better option will be the arginine, guys. Better option will be arginine. Is it okay? And now welcome to the third category, guys. Category number 3, based on metabolic fate. Based on metabolic fate, guys. Okay. Now all your 20 amino acids, they will undergo metabolism, and after undergoing metabolism, remember, some of the amino acids are going to form the ketone bodies. Some of the amino acids are going to form the ketone bodies. Some of the amino acids are going to form the glucose, okay, glucogenic amino acid, and some of the amino acids are going to form both glucose as well as ketone bodies, guys. Glucose as well as ketone bodies. I repeat again, the amino acids which are going to form ketone bodies are ketogenic amino acid. And my dear doctors, remember, only there are two of them. Again, it is about example. Number one, you'll be having leucine, and number two, there will be lysine, guys. So now one is leucine, another one is lysine. And again, the same thing. If both the options are given, better option will be your leucine, guys. Better option will be leucine. So remember, leucine is more ketogenic, guys. More ketogenic. So there are two ketogenic amino acids. One is leucine, another one is lysine there. And leucine will be like more ketogenic. Good. Very good. Very good here right now. And now glucogenic and ketogenic, both glucose forming as well as ketone body forming. So glucogenic and ketogenic there, my dear friends. Remember all your aromatic amino acids. Example, aromatic. What are your aromatic amino acids? Number one, tyrosine. And number two will be your tryptophan. And number three will be the phenylalanine. Tyrosine, tryptophan, and the phenylalanine. These three will be your aromatic amino acid. Along with that, remember isoleucine. Acha, ठीक है ना? So I always advise the students to remember aromatic along with isoleucine. Aromatic along with isoleucine. And again, I'll give you like one more method. Yes, the students who love to remember with mnemonic, remember PITT. Okay. Phenylalanine, isoleucine, tyrosine, and the tryptophan. These three are both glucogenic and ketogenic. और अब क्या करोगे आप बच्चों? What are you going to do? Just remember these two, ketogenic amino acid, leucine and lysine, and you are going to remember the glucogenic and ketogenic, guys. Okay, glucogenic and ketogenic, how to remember? Aromatic plus isoleucine, PITT, PIT. And I'm not at all going to remember the glucogenic amino acids, rest all. So rest all will be your only glucogenic. They are going to form only the glucose on metabolism, based on metabolic fates. So my dear doctors, remember, out of these three classifications of amino acid that I have given you, a definite one question pakka in your next MCA exam. 31st August 2020, one question is definitely going to come. Based on structure, okay. Number two, based on nutritional requirement, okay. And after that, based on the metabolic fates. After that, based on metabolic fate. Next one. Now, after this classification, my dear friends, welcome to the next question here right now. What is the source of nitrogen in urea cycle? मैंने आपको क्या कहा था? What I told you? I told you that, yes, my dear friends, I told you that we are not at all concerned about the question here right now, guys. We are not at all concerned about the question here right now. We are actually concerned about the concept. So let us discuss all the points required in the exam about the urea cycle. Let's see about the urea cycle right now, sir. So every question I'm going to do like one concept here right now, sir. Welcome. The first thing, the first thing that you have to remember here right now, my dear friends, remember that, yes, my dear friends, remember that the another name of the urea cycle. What is the another name of the urea cycle? It is also known as ornithine cycle, also known as Krebs-Hansleit cycle. Number one. Number two, what is the location? Urea cycle kahan par hoga? Remember, my dear doctors, urea cycle will be taking place in the liver, and in the liver, it will be taking place where? Both in the cytosol as well as mitochondria. So a urea cycle, few reactions will take place in cytosol and few reactions will take place in mitochondria. Already this question has been asked in your MC exam in 2018, guys. So you got to remember that. Is it okay? And after that, what is the rate limiting enzyme is important. Now, what is the rate limiting enzyme of the urea cycle, sir? It will be CPS1. And what is the full form of that CPS1, sir? Carbamoyl phosphate. Remember, it is carbamoyl phosphate synthase 1, guys. Carbamoyl phosphate synthase 1, CPS1, is the rate limiting enzyme of the urea cycle. And now, welcome here. What is the formula of urea? Come on, guys. Can anyone tell me what is the formula of urea? Urea का formula क्या होता है? What is the formula of urea, guys? Come on. Come on, my dear friends. The formula of urea will be like NH2CO NH2, guys. And one of the trending question what they're asking in the exam is that, yes, NH2CO NH2. Yes, very good, guys. The first NH2 here, it is given by your or contributed by the ammonium ion. It is contributed by ammonium ion. The CO group is contributed by the carbon dioxide, CO2. And finally, one more NH2 group is given by aspartate or aspartic acid. So that is what they're asking in the exam nowadays, guys. So you're able to learn the formula of the urea as well as you're able to learn what are the sources, from where are you getting that. So the first NH2 group is from ammonium ion, CO group is from carbon dioxide, and one more NH2 group is from the aspartate. And my dear doctors, all my dear foreign medical graduates, whatever you're able to see on the screen, come on, make a note of that. Make a note of that, guys. These are the points you have to refer in the morning of 31st August before going to the exam. आप ये points देखकर जाओगे exam को. That's all. ठीक है ना? So let's repeat again. Urea cycle, ornithine cycle, or Krebs-Hansleit cycle. What is the location of that? Liver. Where inside the liver? Cytosol and mitochondria. What is the rate limiting enzyme? CPS1, carbamoyl phosphate 1, and urea formula will be NH2CO NH2, guys. That's all. Okay now. After that, after clearing your MC exam, come for preparing the NEET PG and AIMS exam, guys. I'll teach you the entire cycle. Abhi we are left out with the 5 days, and for at least 5 days, you have to remember this one. ठीक है ना? 5 दिन के लिए याद रखो, एग्जाम के लिए जाओ, एग्जाम लिखो, उसके बाद में भूल जाओ सर. ओके ना? Enjoy your life. So for 5 days, you are going to remember these points here right now. Welcome. So what is the source of nitrogen in the urea cycle? Yes, the first NH2 is given by ammonium ion and the second NH2 is given by aspartate. That's the right answer. So as I'm telling you, we are not at all concerned about the question. I am concerned with concept, guys. So every question, one concept. Chali, a concept ho gaya. Welcome to the next concept right now, sir. Nitric oxide is synthesized from tyrosine, arginine, histidine, and then cysteine, guys. Now, my dear doctors, listen here. This is like 2019 MC exam question. This is 2019 MC exam question. But I'm not concerned with this one. I'm concerned with what? Welcome here right now, guys. Amino acid and their important metabolic products. Okay, na? Another category of questions that they are asking nowadays in 2018 and 2019, they're asking amino acid and the important metabolic product. I hope you're writing there. Everyone, guys, I hope you're writing there. Just take pen, paper and write down. This is all like high yield. Everything is like one question there, guys. Is it okay? लिखते जाओ सर, ठीक है ना? आप लोग को देखकर बताने मेरे को आज आपसे ज्यादा मेरे को ज्यादा एनर्जी आती है. I'm feeling like more energetic today, guys. We are going to rock this exam, है ना? चलिए सर, लिखते जाइए. चलिए सर, लिखो सर, amino acid. Now, my dear doctors, amino acid number 1, remember tyrosine. Tyrosine amino acid, that is your aromatic amino acid, it is going to form number 1, Melanin. So I hope you all know that pigment, melanin, present in your skin, hairs and all. Yes, that is the one which is going to form melanin. And then tyrosine is also going to form your thyroid hormones, T3 and T4, guys. It is also going to form thyroid hormones. And tyrosine is the one which is going to form catecholamines. Tyrosine is the one which is going to form the catecholamines. I hope all my students are experts in catecholamines, that is dopamine, and then epinephrine and norepinephrine, guys. Okay. Remember, the three substances formed from the tyrosine. Tyrosine is going to form melanin, T3, T4, and catecholamines. Don't get distracted. Don't keep your mind here and there, guys. In the class for 1 hour with me, the moment you write, keep on repeating that in your mind, sir. Come on. Tyrosine. Tyrosine is going to form what, sir? Melanin, T3, T4, and catecholamines. Melanin, T3, T4, and catecholamines. Done. Number 2 amino acids, that will be your tryptophan. Tryptophan क्या form करेगा? It is going to form melatonin. Oh my God. Now starts the confusion here right now. Be very careful. It's going to form melatonin. It's a hormone produced from your pineal gland, maintaining the biological clock, the circadian rhythm, guys. And whereas this one is melanin. Okay. Melanin from the tyrosine, melatonin from the tryptophan. Yes, very good. Number 2, it is also going to form serotonin, guys. And I hope you all know the another name of serotonin. It is also known as 5-HT, 5-hydroxytryptamine. Okay, now 5-hydroxytryptamine. Yes, yes. Dekho, Mayur is helping us with the mnemonic also there. It seems we have to remember, tryptophan, tryptophan, and remember melatonin. If you're getting confused in the exam, on 31st August, 19 subjects in your mind, and there'll be a lot of tension. Okay, na? So tryptophan, melatonin. Is it okay? Another one will be on serotonin. Now the next substance which is formed from here will be melatonin, serotonin, and the most important one, that will be your vitamin B3, guys, which is nothing but your niacin. So vitamin B3, it's formed from tryptophan. Next, number 3 amino acid. Welcome here. That's your Arginine. And Arginine is going to form nitric oxide. Can anyone tell me what is the formula of the nitric oxide, guys? What is the formula of the nitric oxide? Nitric oxide ka formula kya hoga, bachcho? Yes, very good. That is NO. So nitric oxide NO will be formed from the arginine, guys. That is actually your 2019 question. And I hope you all know it's a very good potent vasodilator. Number 4, remember another amino acid, that is histidine. And histidine is the one which is going to form what's a histamine. Histidine is going to form what's a histamine, your favorite. Your entire pathology is filled with histamine only. Like every disease, I don't know. You people are like very great. You learn like every subject, all 19 subjects. लेकिन मुझे तो ना pathology में हमेशा हर जगह पर histamine ही नजर आता है, every disease. And that histamine that you see is actually formed from which amino acid? That is histidine. It is formed from histidine. And one of the questions that was asked in your MCA exam is that, okay, yes, histidine is going to form histamine by which reaction? That is by decarboxylation. Remember, histidine is going to form histamine by decarboxylation. Remember all these things, guys, for now. So what is the another category of question that they can ask in your MCA exam? Okay, amino acid and what is the important product obtained from that? Important metabolic products. Okay, now. So चलिए हम एक बार revision करते हैं, sir. Let us revise once more. Tyrosine amino acid is going to form melanin, T3D4, and catecholamines. Tryptophan is going to form melatonin, serotonin, and vitamin B3. Arginine is the one which is going to form nitric oxide, NO. And finally, histidine is the one which is going to form what, guys? Histamine. Histidine is going to form what, sir? Histamine. Keep this in mind. And definitely one question is going to come from this golden table here right now. Lovely. Welcome back to the question here right now. Nitric oxide is synthesized from where? It is going to be synthesized from arginine. I think now for my students, it's like a cakewalk right now, guys. आराम से हम लोग ना ये आंसर कर सकते हैं. So that's your third concept. Are you understanding my strategy of discussion here right now? कि मैंने आपको कैसे plan किया है? So in the very first question, we are perfect with all the classification of amino acid. Done. In the second question, I told you everything about the urea cycle. One more concept or the points to remember. And now welcome to the third one, the amino acid, and then what are the important products obtained. The question can come from that. And please remember, guys. Okay, now fine here right now, guys. So I'm seeing all your comments there. Thank you all. Thank you all. Thank you all. Love you all, guys. Okay. Now welcome, guys. Next one. The folds in the collagen is Oh my God, my dear friends. Yes, my dear friends, welcome here, welcome here, welcome here. The folds in the collagen are actually formed from glycine. The folds in the collagen protein are formed from glycine. And now, why am I telling you like, oh my God, here right now? Nowadays, my dear friends, mark my words, glycine is like, trending topic in your MCA exam. Your MCA exam is not at all getting tired of asking glycine, 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 sir. हमेशा glycine पूछ रहा है, ठीक है? Is it okay? Many question about glycine, guys. तो glycine पढ़ना जरूरी है. चलो बच्चों हम लोग पढ़ते हैं. Now, what is the first point to remember about glycine? Remember, out of the 20 amino acid, it is the simplest amino acid. So out of all the 20 amino acid, which is the simplest amino acid? Glycine. Question number 2. It is the most abundant amino acid. It is the most abundant amino acid in collagen protein. In collagen protein, it is the most abundant. It's given in the books that every third amino acid in collagen is glycine. Oh my God. And that was a question in your MC exam. Take care about that. And the third point, remember that that is the one which is responsible for the bends, or we can say the folds, or you can use even the word there as flexibility. So tomorrow in the exam, I don't want my students to get confused. So bends in the protein, or fold in the protein, or flexibility in the protein. Yes, it's due to what, guys? In proteins is due to which protein there, which amino acid there, that is glycine. Understanding here right now? So chaliye bachcho, out of all the 20 amino acid, which is the simplest amino acid? Glycine. Most abundant amino acid in the collagen? Glycine. The bends in the protein are formed by glycine. Swaha. So मेरे बच्चों, these are the 3 points to remember. सवाल क्या दिया गया है? What is the question given here right now? The folds. Yes. The folds in collagen. What is a collagen? Collagen is a protein, and in that it is your glycine, guys. So it is the simplest and the most abundant amino acid, and my dear friends, it is responsible for the bends. And after that, I'm not going to leave you here because it is nowadays very important topic. So I don't want to take like any risk. Please write down there what are the important products obtained from glycine, sir. Number 1, glycine helps in the formation of heme. Heme synthesis, yes, we require what's a glycine. Glycine helps in the synthesis of purine ring. Glycine helps in the formation of what, guys? Purine ring. Purine ring, not the pyrimidine ring. अपने दिमाग में बिठा लो, not the pyrimidine ring, only the purine ring, guys. Okay. Next, after that, remember, my dear friends, it is also required for the formation of glutathione. Glutathione. Glycine is required for the formation of glutathione. And glutathione is made up of like 3 amino acid tripeptide. Remember, with my logic, I'll give you one trick here right now. Okay. Do you want to learn the trick right now? Do you want to learn the trick right now, guys? Yes. Remember gluta, that is your, and thio means what's a sulfur containing, and sulfur containing amino acid will be cysteine. Sulfur containing amino acid will be cysteine. And last में क्या लिखा है? ONE1, and ONE1 is nothing but the first one amino acid, and that will be your glycine. Lovely, guys. ठीक है ना? तो उसके नाम में ही लिखा है. That's there in the name itself. ठीक है ना? So therefore, gluta, that is nothing but the glutamate here right now, and then the sulfur containing amino acid, that is cysteine here right now, and finally ONE1, the first one amino acid, that is your glycine here right now. So that's glycine. Lovely. And after that, my dear friends, remember, it is also helping in the formation of creatinine also, guys. Remember, it is also helping in the formation of synthesis of creatinine. So glycine is going to form like important products. Number 1, it is going to form heme. Number 2, purine ring. And number 3, glutathione. And number 4, the creatinine, guys. Glycine is going to form heme, purine ring, glutathione, creatinine. Heme, purine ring, glutathione, creatinine. Apart from that, it is also required for what, sir? Another function of glycine, it is also required for conjugation of bile acids. It is also required for conjugation of bile acids. And I think you have learned in the physiology part, it is also acting like a neurotransmitter. Glycine also acts like a neurotransmitter, guys. Okay, very good. Okay. So these are all the substances formed from the glycine. And then here, guys. So in this question, my intention was completing one more amino acid, sir, that is a glycine amino acid. Done here right now. Okay. So in today's class, my dear doctors, yes, in today's class, my dear friends, what is my planning? I'm planning to make you people perfect in the topic. So we'll do electron transport chain. So these many topics we'll do today. And similarly, we'll be having like one more session tomorrow. And tomorrow, the next session will be, all about your, yes. Tomorrow, the next session will be all about your carbohydrates and proteins and all, guys. Okay? Chaliye, sir. Done. Now the next thing. Now, my dear friends, welcome here right now. The next question is about the albinism is due to deficiency of which enzyme, sir? Albinism is due to deficiency of which enzyme? Yes, everyone knows it is due to deficiency of tyrosinase. लेकिन यार मेरा intention यहाँ पर क्या है? What is my intention here right now? My planning here right now, we are all done with the functions of amino acid, and now yes, now it's all about the defects right now, guys. What are the diseases and what will be the enzyme deficiencies? Examiner can ask a question from here also. Okay, तो चलिए सर एक और टेबल बनाते हैं, and in this table let's cover all the diseases in the protein metabolism here right now today. So welcome my dear doctors here right now. So in protein metabolism, let us see all the disorders in the protein metabolism here right now. So there are only 3 of them. First, you remember the major ones, guys. Number one disorder in the protein metabolism will be your phenylketonuria. Oh my God, the very much important one. Phenylketonuria will be, yes, in short, बड़े प्यार से हम इसको ना PKU कहते हैं. Phenylketonuria will be PKU. Okay, and what is the enzyme deficient in this one? It is due to deficiency of phenylalanine hydroxylase. What is the enzyme deficient here right now, guys? Phenylalanine hydroxylase. That is PAH. Do something. Remember here right now, guys. Phenylketonuria, the enzyme deficient here right now will be phenylalanine hydroxylase. Okay, guys. Number one disease. Number two, you have to remember about the alkaptonuria. Alkaptonuria. And that disease, it's also known as the black urine disease. Black urine disease. I hope you all remember, yes, in our regular classes, we have discussed already, guys, what is going to happen here right now in alkaptonuria. You collect the urine sample from the patient and keep it without disturbing for some time. The word that is used in your exams will be urine on long standing. Urine on long standing without disturbing. The color of the urine changes to black color or coke color. Black color or coke color. Okay. So alkaptonuria, yes, or black urine disease will occur due to deficiency of which enzyme? It occurs due to deficiency of homogentisate oxidase. So the name of the enzyme here will be your homogentisate oxidase, guys. Homogentisate oxidase. Okay, that's important. So they can even give you an image-based question here right now. In one test tube, will be having the urine. Normal color of the urine will be like slightly yellowish in color. But within some time, what is going to happen? The color changes to what? The black color or coke color, guys. So alkaptonuria will occur due to deficiency of homogentisate oxidase enzyme. Next, number 3. And the third disease that you have to remember here right now in the protein metabolism, maple syrup urine disease. Maple syrup urine disease, guys. Okay, that is a disorder because of which one, guys? The metabolism of branched chain amino acids, guys. That is the disorder associated with the branched chain amino acid. And few minutes before only I told you what is the name, what are the 3 branched chain amino acid? Valine, leucine, and isoleucine. Valine, leucine, and isoleucine will be the branched chain amino acid. Okay, and yes, welcome here right now, my dear friends. What is the name of the enzyme deficient here right now? Branched chain keto acid. Branched chain keto acid dehydrogenase. So it's a big name of the enzyme. You got to remember that. Very important. Recently asked in the exam, guys. Branched chain keto acid dehydrogenase. Is it okay? And in short, I think some of my students remember from the regular class. In short, I remember this one as BCKD. Okay, now absolutely don't take me wrongly. I'm actually telling you the name of the enzyme and how to remember that one. Is it okay? Fine here. Yes, it's branched chain keto acid dehydrogenase. Branched chain keto acid dehydrogenase. Okay, now BCKD. Deficiency of that BCKD enzyme will lead to maple syrup urine disease. इसका नाम क्या रखा गया सर? Maple syrup urine disease. Fine. Acha, by the way, why is the name given as maple syrup urine disease, sir? Yes, because of the characteristic odor. And what is the odor of the urine here right now? The odor of the urine in this disease will be like burnt sugar. So here in maple syrup urine disease, it is like burnt sugar like odor or burnt sugar like smell in urine, guys. Is it okay? So every point there on the screen is important. Remember this for the 5 days, guys. Understanding here right now? So the smell of the burnt sugar, maple syrup urine disease, BCKD deficiency, maple syrup urine disease, and which amino acid? BCKD, branch chain. So branch chain amino acids are valine, leucine, isoleucine. Done. Kalas. Okay. So these are the three important diseases that you have to remember. These are the three important diseases that you have to remember at least for your MCA exam. I'm expecting one question from here. Okay, ji. And now, my dear friends, number 4 here, right down there. Number 4, one more. The question that I have given you here right now, sir, that is your albinism. And albinism is actually due to deficiency of the which enzyme there. The name of the enzyme will be your tyrosinase. यार ये तो मैंने आपको अभी बताया. Apply common sense. Amino acid is going to form melanin. Melanin is formed from tyrosine. With the help of which with the help of which enzyme, sir? Tyrosinase. So tyrosinase deficiency. Deficiency of tyrosinase, no melanin, the white patches on the skin leading to albinism, guys. Lovely, done. So 4 diseases. ठीक है जी. अब यार ये बताओ, do one thing here right now, my dear friends. Hello, my dear friends. Do one thing here right now. Think like an examiner here right now. Okay ना, थोड़ा ना examiner की तरह यहाँ पर सोचिए. We have completed the classification of amino acid, and we are done with all the functions of the amino acid and their important products obtained, and we are done with the diseases. Let them and give any question in the exam. We are ready for that one. Okay, na? So please follow every question, one concept there, guys. Let them give any question in the protein metabolism. We are ready. Just learn this one and go to the exam, guys. Just learn this one. Pakka, there'll be a question coming from here. So now the next question, guys. Yes, limiting amino acid which is seen in the Hartnupp's disease. यार अब ये Hartnup disease में क्या होता है? Tryptophan here right now, sir. So already all the diseases I have completed on the screen here right now, guys. And one more disease I'm covering here right now. So please remember that one. So in Hartnup disease, what is going to happen, guys? In Hartnup disease, what is going to happen there? Yes, there'll be decreased absorption of the amino acid, and that is tryptophan will be decreased inside the body, guys. And obviously, I told you in Hartnup disease, there'll be decreased tryptophan. Decreased tryptophan, it is unable to form, vitamin B3. Agar ye form nahi hoga, then it obviously will lead to the disease that is your pellagra, and that is your favorite disease, 3D disease, guys. Dementia, diarrhea, and dermatitis. Dementia, diarrhea, and dermatitis. If not treated, 4th D, that is death. After completing all the amino acids, yes, update your knowledge. Which of the following is 21st amino acid? Yes. Selenocysteine will be the 21st amino acid, guys. Lovely. And remember, my dear friends, pyrrolysine will be the 22nd amino acid. Selenocysteine will be 21st amino acid, and the pyrrolysine will be 22nd amino acid. This is what you have to remember here right now. Now, just, this is like, factual question. You got to just memorize here. Selenocysteine is 21st amino acid, and 22nd will be pyrrolysine. Can anyone tell me, guys, selenocysteine is synthesized from where? It is produced from where? Selenocysteine will be produced from where, sir? Yes, very good. Lovely, lovely, guys. Look at that. Love you all. Very correct answer. Remember, selenocysteine is produced from serine. It is, yes, produced from where, sir? Serine. Some of the students in the middle, they are answering as cysteine, wrong, and selenium, wrong. Remember, it is actually serine. Next, inhibitor of the complex number 4 in electron transport chain. Now, what is our topic right now, guys? Our topic now is electron transport chain. Come on, guys. So many topics we are completing in the minimum time possible here right now, guys. So please pay attention here right now. Please pay attention here right now. Now the next topic, my dear friends, here right now, the next topic here right now is electron transport chain. Write down there in your books there with another color pen or pencil. Pakka one question from this topic. Definitely one question from this topic. And I will tell you right now what to learn here right now, sir. Likho. Number 1, electron transport chain. Bolo bachcho kahan par hota hai? Where is electron transport chain taking place? It is taking place in mitochondria. Even first year MBBS student also knows mitochondria. Remember, inner membrane of mitochondria. Which membrane of the mitochondria, sir? Inner membrane of the mitochondria. That is something important here right now. Lovely. Come on, guys. How many protein complexes do you have in electron transport chain? There are like 5 protein complexes. Complex number 1, 2, 3, 4, 5. And here, remember the another name of that one. Complex number 1, it is also known as NADH dehydrogenase, or we can also call it as oxidoreductase. Complex number 2 will be succinate dehydrogenase. Okay. Complex number 3 will be cytochrome reductase. Very good. And finally, the complex number 4 will be the cytochrome oxidase. Okay, ji. And finally, my dear friend, the complex number 5 will be your F0 F1 particle. F0 F1 particle, guys. Come on, come on, come on, guys. Come on, revise. We are hardly left out with the 5 days for the exam, guys. Okay. It's like I'm on fire today. ठीक है, चलो सर. तो इलेक्ट्रॉन ट्रांसपोर्ट चेन में पहला पॉइंट क्या पढ़ोगे? फर्स्ट पॉइंट यू आर गोइंग टू लर्न, इट इज टेकिंग प्लेस इन इनर मेम्ब्रेन ऑफ द माइटोकॉन्ड्रिया. हाउ मेनी प्रोटीन कॉम्प्लेक्सेस? 5. लर्न देयर नेम्स. एंड नाउ वेलकम टू द मोस्ट इंपॉर्टेंट थिंग in electron transport chain, that is inhibitor. Expecting this question on 31st August 2020. Okay, expecting this question on 31st August 2020. Don't ask me how. Welcome here right now, my dear friends. Now, what are the inhibitors of electron transport chain? Number 1, have you heard about carbon monoxide poisoning? Have you heard about the carbon monoxide poisoning, guys? The formula of carbon monoxide, CO. CO inhibits which complex? Complex number 4. Which complex? Complex number 4. But your examiner is actually a cunning fellow, and he will never give you complex number 4 करके वो नहीं देगा sir. He will always give you the name, and the first 2 option will be, and our student subjects in mind full of tension. So how to remember for the exam? We are also very intelligent here right now, guys. Remember, carbon monoxide CO inhibits CO. So some of the students na in the exam they are doing like inky pinky ponky, reductase oxidase, reductase oxidase. Don't do that. CO inhibits CO. You will never forget in the lifetime. जिंदगी में नहीं भूलोगे आप, ठीक है ना? Next one, cyanide poisoning inhibits complex number 4. And after that, H2S, hydrogen sulfide, inhibits complex number 4, guys. Lovely. So carbon monoxide inhibits complex number 4, cyanide complex number 4, and H2S inhibits the complex number 4. Lovely. Complex number 1 is inhibited by, I think you have learned pharmacology, my dear friends. Do you remember phenobarbital? Yes, that is a barbiturate, a sleeping pill, guys, resting pill. Now, phenobarbital, it's actually very good. If you take like 1 tablet and you'll be getting a nice sleep for, whole night. लेकिन हमारे इंडिया में क्या करते हैं सर? ओके ना, हस्बैंड एंड वाइफ फाइटिंग, गर्लफ्रेंड एंड बॉयफ्रेंड फाइटिंग. आफ्टर फाइटिंग दे आर नॉट टेकिंग लाइक 1 टैबलेट, दे आर टेकिंग लाइक ऑलमोस्ट लाइक 15-20 टैबलेट. सुसाइड. ठीक है ना? तब क्या हो जाएगा? टॉक्सिसिटी होगा. एंड phenobarbital is going to inhibit the complex number 1. Lovely. So try to make some story and remember there, guys. Yes, phenobarbital inhibits complex number 1. Number 2, rotenone. Okay, rotenone inhibits the complex number 1. And I will tell a trick to my students how to remember this for the exam. Look at the spelling. ONE1 inhibits the first complex. ONE1 inhibits the first complex, guys. Okay, ONE1 inhibits the complex number 1. Lovely. Complex number 2, it is inhibited by malonate. Malonate inhibits complex number 2. And then, my dear friends, remember, complex number 5 here, it is inhibited by the oligomycin. चलो बच्चों, एक बार दोबारा करते हैं very fast right now, guys. We are left out with the last 10 minutes here right now. Welcome. Carbon monoxide inhibits number 4. Cyanide inhibits number 4. H2S number 4. Rotenone and phenobarbital, ONE1, complex number 1. Malonate inhibits complex number 2. And then finally, oligomycin. Oligomycin inhibits, yes, oligomycin inhibits the complex number 5. Is it okay? Complex number 5. Azides will also inhibit the complex number 4, guys. ठीक है ना? Complex number 3, रोशनी or Rouhani. Okay, Rouhani Ketan. Complex number 3 is actually inhibited by anti-mycin, but that is not that much important for your exam, guys. ठीक है ना? आपके एग्जाम के लिए ना इतना ज्यादा इंपॉर्टेंट नहीं है. जितने मैंने बताया उतने याद रखिए. ठीक है? After that, yes, nowadays they are asking about transport chain. They are going to uncouple which reaction? They are going to uncouple the oxidation and phosphorylation reaction, guys. welcome to my regular class. I'll tell you like what is that in detail. लेकिन अभी के लिए rapid fire for our exam next 5 days. Welcome. So it's going to uncouple the oxidation and phosphorylation reaction. What is the example of uncoupler is important. 2,4 dinitrophenol is one of the example, guys. Another one will be your aspirin. These two are your uncouplers. Are they produced inside of a body? No, they are not produced inside of a body. They are taken like drugs. 2,4-DNP and aspirin. Are there any uncouplers which are produced inside of a body? Yes, we do have the uncouplers produced inside of a body, and those are known as physiological uncoupler. Come on, guys, come on. Physiological uncouplers. Now, what will be the physiological uncoupler? Number one, write down there as thermogenin. Thermogenin, okay. Number two, please write down there as thyroxine. Thyroxine. Okay, thermogenin and thyroxine. Along with that, my dear friends, even include the bilirubin there. And along with that, I want you also to include the free fatty acids. Free fatty acids. The people who are actually using my previous session notes there, these two examples are not given there, guys. Please add there. इनको ना add करना वहाँ पर, ठीक है ना? Please add there in your previous notes, guys. So thermogenin, thyroxine, the bilirubin, and the free fatty acid, all this will be acting like your physiological uncoupler. Uncoupler क्या करेगा? Uncouples the oxidation and phosphorylation reaction. Because of that, what will happen? Normally ATP synthesis will be decreased. Yes. And then what is going to happen there, guys? Yes, ATP synthesis is decreased, and whatever energy is released, that will be in the form of heat energy. I think you have learned about the thermogenin in the pediatric subject also. Thermogenin will be actually found where, guys? It will be found in the infants in the brown adipose tissue. Thermogenin will be found where, sir? It is found in the brown adipose tissue, or you can remember brown fat. Brown fat. Okay? Find my difference here right now, and that is helping in generation of heat in the infants, guys. So these are the things to be remembered for electron transport chain, nothing else. Okay? So while going to the exam, on the way, my dear friends, you are going to revise these points. Number one, electron transport chain. Where it is going to take place, sir? Inner membrane of the mitochondria. And number two, you are going to remember the inhibitors of electron transport chain. And number three, my dear friends, you are going to remember the uncouplers of okay, the electron transport chain, guys. Done. So what is the inhibitor of the complex number 4 here? It is the cyanide here right now, sir. Next one, next concept. So in this way, my dear friends, every topic, I'm completing here right now. I'm not concerned with the questions there. I'm concerned with the concept there, guys. Concept there. Electron transport chain, class. Urea cycle, class. Classification of amino acids, done. Diseases of all the amino acids, done. Important products from the amino acids, class. समझ में आ रही है बात आपको? Yes. Welcome here right now, sir. Next one. अब आ जाइए से next topic. Next topic. True about the reversible non-competitive inhibitors. Yes. In today's like 1 hour of the class, see how many things we are actually revising here right now. Reversible non-competitive inhibitor. बच्चों यहाँ पर देखो. Everyone look here. Now welcome after completing the electron transport chain topic. Now welcome to the topic of enzymes. In enzymes topic, enzyme inhibition. ठीक है ना? Enzyme inhibition. Please write down there in your books there. Yes, it's a short question. Okay na, pakka question, definite question. ఖచ్చితంగా వస్తుంది sir. Okay na, definitely this question is gonna come in the exam, guys. आ चुका है, print हो चुका है, लिख लो sir. ठीक है ना, सूत्रों के अनुसार. Now, enzyme inhibition, my dear friends, here right now, guys. There are two types of enzyme inhibition: reversible and irreversible. From the name itself, you can understand there. Reversible and irreversible enzyme inhibition. From the name itself, you can understand the inhibition which can be reversed, the inhibition which cannot be reversed. Out of these two, my dear friends, remember, reversible inhibition is in turn divided to two categories here right now. So one will be your competitive inhibition. One will be the competitive inhibition. Another one will be your non-competitive inhibition, guys. Non-competitive inhibition. Okay, na? And my dear doctors, remember what is going to happen in the competitive inhibition. In the competitive inhibition, the maximum velocity, that is Vmax, value remains the same. Before adding inhibitor and after adding inhibitor, the value of the Vmax, maximum velocity, remains the same. And finally, yes, one more thing, sir, Km, Michaelis-Menten constant. Michaelis-Menten constant value will actually increase, guys. Okay, na? Understanding, my dear friends, here right now? So in competitive inhibition, In competitive inhibition, what is going to happen? Yes, my dear doctors. In competitive inhibition, you do something, and remember these two words here right now, guys. After clearing your MCA exam, come back for studying for NEET PG and AIMS exam. At that time, I'll teach you with the help of the graph and all those things. I'll teach you. But for 5 days, remember, do something and remember, guys. Yes, Vmax remains the same in competitive, and the Km value will actually increase. Okay, and do the exactly opposite of that in the non-competitive. In the non-competitive, my dear friends, exactly opposite. Km value will remain the same, and whereas V max value will actually what happens, sir? Decrease. Completely opposite. So remember any one thing. I remember like this, guys. Just remember like one thing, and telling here competition में ज्यादा काम करना पड़ता है, तो competition में ज्यादा काम km increases. Love you सौरभ, ठीक है ना? competition में ज्यादा काम करना पड़ता है, ठीक है ना? हाँ ठीक है, तो जैसे याद करना याद कर लो, लेकिन याद रखो सर, डू समथिंग बट रिमेंबर टिल द एग्जाम. 31st को एग्जामिनेशन हॉल में जाओ, इस नॉलेज को वहां पर पेपर में डंप करो, ओके ना? उसके बाद में नाचो सर, एंजॉय योर लाइफ, ठीक है ना? यस. So competitive inhibition, Vmax remains the same and the Km increases. Non-competitive, Km same and the Vmax decreases. Definite question gonna come on 31st August, guys. Take care about that. Okay, ji. So true about reversible. Non-competitive, what is going to happen, sir? Yes, lower. Non-competitive, what will happen? Vmax will decrease there. Km same, Vmax will decrease there. ठीक है, next one. तो अभी के लिए ऐसे याद रख लो सर. In the regular classes, I'll teach you with in detail with the graph and everything. I'll teach you. Done. Acha. One more thing that I want you to remember in the enzyme topic here right now, my dear friends, is about the Km value. You know, what is this Km? Michaelis-Menten constant. Yes, what is that Michaelis-Menten constant? Look at this graph here right now. This graph is actually your Michaelis-Menten graph, sir. Guys, another 4-5 minutes here right now. Just be with me, okay? Completely be with me. Don't think about anything in your life right now, guys. Okay, now just be with me here right now. Michaelis-Menten graph. These graphs give the relation between the concentration of the substrate and the velocity of the reaction. And remember, it's directly proportional. In a reaction, substrate is getting converted to product in the presence of enzyme. The velocity of the reaction will also increase. It's directly proportional. So we are going to take the substrate concentration on x-axis, lovely, and the rate of the reaction, velocity of the reaction on the y-axis. Okay, lovely. Now what I tell you, in this, they are directly proportional. If it is directly proportional, more the substrate, more will be the velocity. Substrate badega, velocity bhi badega. I am getting a parabolic graph here right now, sir. A proportionate graph, parabolic graph. Lovely. Now in this graph, where do you find the maximum velocity, guys? Okay, somewhere here, we are attaining the maximum velocity. Okay, exactly half of the maximum velocity, sir. Somewhere here in the middle, that is Vmax by 2. I'll write it separately here, Vmax by 2, sir. Half of the maximum velocity. Right at that, yes. What is that one, guys? How much will be the concentration of the substrate? And yes, this much will be the concentration of the substrate. And that is nothing but your Km value. That is the easiest way to remember right now, guys. So what is the meaning of Michaelis-Menten constant? Michaelis-Menten constant, remember the Km is nothing but the concentration of substrate required. How much amount of concentration of substrate required to attain half the maximum velocity? हमको कितना सबस्ट्रेट चाहिए टू गेन द हाफ द मैक्सिमम वेलोसिटी, सर? हाफ ऑफ द मैक्सिमम वेलोसिटी, उस वैल्यू को हम क्या कहते हैं? Km. And that itself is directly given as a question here right now, guys. Okay. Km value is defined as the substrate concentration at half the maximum velocity. At half the maximum velocity. So in enzymes topic, my dear friends, you are going to remember these concepts. Enzyme inhibition is at guys. Nature of the enzyme will be protein in nature. Protein will be apoenzyme, and the non-protein part will be there along with that. That is nothing but the coenzyme. अगर दोनों को मिला दोगे, and that is together, that is going to form your complete enzyme, guys. Okay, now that is your holo enzyme. So nature of enzyme is also important if you want to remember. Next one. Now this concept is actually a big concept here right now, sir. What is attached to the 3' end of the mRNA after transcription? Yes. Can anyone tell me, guys? This question is about the post-transcriptional modification. Post-transcriptional modification, guys. Come on, tell me. After transcription, what is going to happen, sir? The post-transcription modification. There'll be three of them. Just write down there. Actually, I thought of teaching you this in detail there, but we are having just 2 minutes of time left out here right now. Post-transcriptional modification. My dear friends, another pakka question. Another pakka question. This is the hot favorite topic of your MC examiner. यहाँ से सवाल आएगा. How many of them you have to remember? Remember, in the RNA, suppose this is your RNA here right now, guys. HNRNA. 5' end and the 3' end. What is the modification at the 5' end? The modification at the 5' end will be 5' capping. Will be 5' capping. And in the capping, what are we going to attach there? That is 7-methyl guanosine, guys. Okay, I'll just write down here. What is the modification, sir? 5' capping. And in 5' capping, you are going to attach what? The substance that is attached there will be 7-methyl guanosine. 7-methyl guanosine. 7-methyl guanosine. And at the 3' end, yes, the modification there will be the poly-A tail. Poly-A tail will be there, guys. A long chain of adenines will be attached there. And in the middle, you're going to do what? Splicing. And splicing ka matlab kya hota hai? What is the meaning of splicing? A removal of intron and the ligation of exon, guys. And yes, come on, guys. How many modifications to remember? 3. Tell me loud and clearly. Zor se bolo. Okay. What is the modification at the 5' end? 5' capping. What is attached there? 7-methyl guanosine. What is the modification at 3' end? That is poly-A tail. And then what is the modification in the middle? Is splicing. And splicing means a removal of intron and the ligation of exon there, guys. Okay. And at 3' end, remember, my dear friend, what is the modification there at the 3' end? Poly-A tail. Are you all getting my point here right now? And this is like another very, very important topic, guys. So in this way, my dear doctors, yes, we have completed today about the amino acid, classification of amino acid, yes, the diseases in the amino acids, electron transport chain topic, the enzymes topic. I think it will help you a lot, guys. So I think in 1 hour, this is the best way it can be revised, guys. This is the best way it can be revised in 1 hour. So all those topics, I think you have written on the piece of paper there, guys, and remember them. Okay. So thank you all the best. I'm always along with you to help you people, guys. So today, one session done. Join me tomorrow in the same manner. Like 1 hour, definitely we'll have like, carbohydrates, the protein metabolism, and the vitamin. Justice हो सका मैंने किया sir. So all these are like very high topics to be remembered. Is it okay, guys? So thank you all, guys. Stay blessed, stay safe. All the best for your exam. I'm always जबरदस्त पढ़ना सर. Okay ना? Study nicely. Chalo. So take care, all of you. Bye bye. Okay. Yes. Remember all these topics. Topics are very much important for your exam, guys. Done. Love you all. Take care. Bye bye. Good night.